Hello viewers, you're welcome to Excel Health Arena, and we are still on family planning. I spoke to us last about hormonal methods of family planning, where I talked about oral contraceptive pills and injectables. And I said both of them, all the hormonal contraceptive pills, how they work is that they make use of hormones, progesterone and estrogen to prevent pregnancy. And summarily, I said the modes of action of these hormones is that one, they prevent the womb from preparing itself to receive the fertilized egg if the egg is fertilized. Two, I also said they thicken the mucus that comes from the cervix, that comes from the mouth of the womb. So when the mucus is thickened, that secretion is thickened, when there is sexual intercourse, sperm finds it difficult to find its way to navigate through the mucus to get to the uterus and to the fallopian tubes, where it's going to fertilize the egg and come back into the uterus. So for that reason, it makes it difficult for pregnancy to occur. And I also said that for strong-headed and stubborn sperms, I said even if it struggles and finds itself, navigates itself through the thick mucus, I said it also prevents the uterus from allowing it to embed, to fix itself into the womb for it to stay and become a fully grown or developed child at the end of the day. And they also prevent the release of eggs from the ovaries. Those are the ways by which I said these hormones work. And I talked about oral contraceptive pills. I said there are those ones that contain 20, each sachet contains 21 tablets. There are those sachets that contain 28 tablets. So for those that contain 28 tablets, you have 21 white tablets and 7 iron tablets. It could be brown, it could be golden or orange color. Okay, so these iron tablets are 7, and after you must have taken the 21st tablet that is white, the 22nd tablet will be the colored one, and you continue like that till you finish up the 28 tablets, and by 29th day you start another sachet, because by that time you would have started and even finished your menstrual period. So usually that is how it happens. I may not be able to take much detail in this on this platform. I am not here to prescribe drugs. I want us to always take note of that. But at the same time, I'm just here to give us, advice and expose us to a lot of things we can do, whereby we can be able to proceed to the hospital or to the family planning clinic to get a better understanding of what we need to do and be able to make informed choice. So I want to also tell us there are certain effects. There is what we call withdrawal bleeding. Withdrawal bleeding happens when you stop the intake of hormones. Hormones through the tablets are taken every single day. So by the time you take 21st tablet, the 22nd day, you stop taking the white tablet because it has finished, and you move to the red tablet or the brown tablet. You will discover that along the line, it will start preparing you for menstrual flow, and you eventually see your menstrual period. So these particular tablets are also used to regulate menstrual cycle. Sometimes when women, maybe due to age, maybe due to hormonal imbalance and some other things, later we can be able to talk about those conditions that could bring about that. So these oral contraceptive pills are also used to regulate the menstrual menstrual cycle and get it back to normal. Okay, so there are those tablets that contain 28 sachets that contain 28 tablets. There are those ones that contain just 21 tablets. And I also said that you must take them at fixed time, regular time, every blessed day, but pick a particular time that is convenient for you. Every morning after food, every afternoon, every night. You must pick a particular time that is convenient for you to take it every day. You must not forget. And if you forget, The very next time, immediately you remember that you forgot to take the last one, you take it. Immediately you remember, take it. But the fact that you have taken it does not mean it has not left a gap, for pregnancy to occur. So what happens in that situation is, though you have taken it, immediately you remembered, you still need to take, some support the method with one of the other methods, just for the month to end, for you to see your menses and be sure that you are not pregnant before you continue to rely on the subsequent use of that oral contraceptives. So for example, throughout the remaining period of the month, you can use condoms if you need to have intercourse, so that you do not expose yourself to pregnancy. And you say that, oh, see you, and they have said it's effective, oh, it's 99 point something effective, and now I'm pregnant. Because there are women that will come, having done one thing or the other like that, they come and start saying, there's often effective. You said it's effective. Yes, it is very, very effective, but you need to do it the way you are asked to do it. So, like I said, I don't want to prescribe. I'm not prescribing here. Majorly what they contain is levonorgestrel and ethylene-estradiol. So those are the contents. And for the iron, they contain iron tablets. So those are the oral contraceptive pills. 21 tablets, 28 tablets, depending on whichever you want. And the mini pill, progesterone only, or progesterone only. Progesterone only. So this one contains just progesterone, and the way it acts is that it alters the cervical mucus, like I said, and it prevents the lining of the uterus from allowing the fertilized egg to embed, even if fertilization takes place. So, and the duration of the tablet is throughout the menstrual cycle. You take the tablet throughout the menstrual cycle. So the disadvantage is that it can increase the rate of pregnancy. Okay, sometimes it has a poor control and it can increase the rate of pregnancy. And funny enough, the advantage is that it can be used even in older women, even with cardiovascular risks. It's quite minimal, and it can be used in older women, 40 years and above. Okay, so now let's talk about postcoital pills. Postcoital pills are pills that are taken on emergency basis. We call them emergency tablets. Yes, you have been exposed to intercourse and you need to prevent pregnancy. How do you do it? Usually, let me say that it is not safe to keep taking this kind of drugs within a period of a month. It is not safe to take it for more than once or maximum 2 times in a month. It is not good enough. So that is why you must engage yourself in the use of regular methods that will always be reliable and will give you minimal side effects. Okay, so postcoital pills, they are just for emergency situations, in case there is a rape, in case the contraceptive method fails. Just like I was talking about pills, that in case you miss a pill for a particular day, the moment you remember, you take it. You can take, if you have intercourse in a situation like that, you can also take the emergency pill, which is postcoital pill, for that period. And usually within 72 hours of exposure to coitus, exposure to intercourse, you can take the postcoital pill. Sometimes even more than 72 hours. There are those drugs, or in this category, that work within 72 hours, that's 3 days. There are those ones that work within 5 days, extension of 2 days. So, and they also prevent, what they do is they prevent the ovary from releasing egg, and it prevents fertilization or implantation. So I don't want to give names like that. I know they contain levonorgestrel, but I don't want to give names so that it doesn't look like I'm prescribing. Now, failure rate for that is about just 1%. and